I wanted to discuss my experiences with ECT or electroconvulsive therapy. But first I thought I should tell you what exactly ECT is. It's a small electrical stimulation to one or both of your temples to stimulate your brain. And it corrects treatment-resistant depression, among other ailments, but that's what I'll be talking about today. You are put under anesthesia for this process, and it only takes a few hours. It's an outpatient procedure under normal circumstances, though it can be done when you are inpatient in a psychiatric hospital. I had it done a few months ago when I was experiencing a severe depression. I was suicidal, and my parents were very worried for me. I went to my doctor and we discussed our options. I was frightened to stay in a hospital, inpatient, because of COVID, and I was, like most people, afraid of catching COVID, and a hospital seems like an iffy place even though the precautions are taken. Well, I decided to go there, outpatient, and every Monday, Wednesday, and Friday for 2 weeks, I would go to a ward, a special ward for ECT, and I would be hooked up to an IV and given medicine for muscle tension. This is because when you receive the stimulation to your temple, your body is sent into a seizure, and sometimes that causes your jaw to tense up really bad. It does for me, at least. And afterwards that leaves you aching a little bit. That's pretty unpleasant. It's not really painful, just uncomfortable. And the medicine helped. So they gave me that. When it was my turn, they gave me my anesthesia and they gave me my treatment. Now, when they gave me my treatment, a psychiatrist, an anesthesiologist, and a nurse were all there to perform the treatment. But before and after, there were a bunch of nurses taking care of me, so I was in very good hands. There are different types of ECT. I got a right side unilateral. That means that only my right side was stimulated. There are other types where both sides of the head are stimulated. I'm honestly not sure under what circumstances those are used, but for me it was right side unilateral. Some people are concerned about memory loss. For me, memory loss only occurred right after the procedure. And honestly, I think it was more because of the anesthetic than the actual procedure. I was very loopy, like a person who had had their wisdom teeth taken out. You've seen those videos, haven't you? And I was a delight to be around if you wanted to laugh. But everything came back to me eventually. And at the end of the course of ECT, after 6 treatments, my depression was gone. I was in a euthymic state of mind. So I hope when you make your decision on whether or not to get ECT, you listen to the facts. That you go to a factual website and do your own research. Because there are a lot of people out there who are very scared of this procedure, who will give you faulty information that is tainted by their own bias. What you need to do is follow some of the links that I give you in the description for this video. It's straight to the facts. It's very cut and dry. And then you can decide for yourself. Okay, thanks.